Hip pain is a common problem among young adults as well as older adults. In fact, 40 to 50% of the population will end up having some sort of hip problem at some point in their lifetime, especially if you play any type of sports. I'm Hina Sheth, and with my experience of 25 years treating complex spine, hip, and pelvic floor dysfunction, I'm going to talk about the 3 most common things that I see of what causes hip pain, and it's not what you think. Number 1, muscle and fascial trigger points and restrictions. There are a lot of muscles that attach at the hip, both from the front, the back, and the side, some of which you guys might be familiar with, such as the gluteals and the rotators of the hip, as well as other muscles in the front, such as your hip flexors. However, people don't realize that there are a lot of other muscles that aren't really even talked about that have direct attachments at the hip, such as the muscles of the pelvic floor. This is a group of 14 muscles located deep inside of your pelvis, and 2 of those muscles actually have attachments to the hip. But there are other muscles that indirectly affect the hip, such as muscles in the pelvis, muscles in the abdomen, muscles in the low back, and even those that you kind of consider as part of the knee. And if any of those muscles are tight and restricted, they can actually cause pain in the hip. And not only these muscles, but there is another thing called fascia. Now, fascia is kind of like cobweb that binds all the muscles together. They run and penetrate through all the different muscle fibers all throughout your body. And if this fascia is tight and restricted, you can kind of think of this as kind of like saran wrap, kind of embodying all the muscles and kind of attaching upper body to lower body, and specifically around the hip, that pelvis, the hip, the buttocks, as well as the front of the thighs and way down into the knee. You can see that if there's any restrictions in that fascia or in that saran wrap, then that is going to cause a lot of pulling and tugging. And it can kind of create things that feel like restrictions or blocks to movement. And so when this fascia and muscle is deep, tight, restricted, it can then start to affect our number 2, alignment. Alignment is super important for all joints of the body in order for them to move freely and to function right. And when we talk about the hip joint specifically, with it being a ball and socket joint, it's really important that the ball sits symmetrically within the socket to prevent wear and tear, such as arthritis down the line, or labral tears, or bursitis, and things like that. But when there is imbalances within that hip socket due to muscle tension and fascial restrictions, then that can end up creating that malalignment. And the other pieces that are really important is that that hip doesn't work alone. Your pelvis, your spine, and believe it or not, even things like shoulder and foot and knee alignment is really important for that hip to function right. So in order for our muscles to function right, we need them to be balanced. And when you have good balance, you have good alignment. Now, when you have those 2 pieces working for you, then you really got to work on number 3, which is the coordination and the firing of all of these muscles together. Having good muscle coordination and firing is equivalent to like having a symphony with musical instruments playing at the right time. And if your muscles are not coordinated correctly, then it's going to kind of be like a symphony where all the instruments are playing at different times. It's not going to feel smooth. It's not going to feel harmonious to your body. And so there are different firing patterns that happen, both in the front of the body, on the side, and the back of the body, as well as deep within your core. And for an example, in the back of your body, there are different sequences that muscles have to fire. Your glutes need to fire before your hamstrings. Your hamstrings need to fire before the opposite side of your low back. And these patterns happen even when it comes to hip function throughout other areas in your body, such as I mentioned, in the front as well as deep within your core. So having good muscle firing pattern and coordination is super important and leads to healthy functional movement. Having healthy muscle and fascial balance, as well as joint alignment and muscle firing and coordination, is the key to a healthy and painless hip, as well as prevention for those diagnoses we talked about down the line. And if you are ready to get your hip pain and stiffness under control and eliminated, then check out our online programs, consultations, as well as in-house treatment.